This is Dr. Farhad Adeshipur from Loma Linda University Medical Center. Here we describe our endonasal rhinoplasty technique for inserting spreader grafts. This technique confirms the correct position of spreader grafts and secures them using barbed knotless suture. Our endonasal rhinoplasty approach began with a full transfixion incision that transitioned into bilateral intercartilaginous incisions. The soft tissue envelope was elevated off the upper lateral cartilages and nasal bones.
Try to recognize the bill.
Bilateral mucoperitoneal septal flaps were raised, and septal cartilage was harvested to create spreader grafts. We elevate the right mucoperitoneal flap up to the extreme dorsal edge of the septum with a suction freer. We attempt to position the spreader graft under the intact cartilaginous middle vault. Despite forcefully lifting the graft with the freer, we are not able to create the desired change in the middle vault. Furthermore, we are not able to confirm the position of the spreader graft cephalically. We separate the upper lateral cartilage from the septum for better visualization. We demonstrate the same dilemma when placing the spreader graft under the intact left middle vault. The left spreader graft is temporarily secured to the cartilaginous septum with a hollow bore needle. A running horizontal mattress technique is used to secure the graft to the septum with a knotless barbed suture. Tying secure knots along spreader grafts in endonasal rhinoplasty with standard suture can be technically challenging because of limited exposure and visualization. Barbed sutures are effective and efficient devices that avoid the need for difficult knot tying deep in the nose, especially cephalically. There is no need to tie knots, so the suture ends are simply trimmed. The contralateral spreader graft is next secured with the barbed suture in the same fashion. The suture passes through the left spreader graft, traverses the septum, and then exits the right spreader graft. There are several different manufacturers of barbed sutures, which come in various materials, diameters, needle types, and barb sizes. A different type of barbed suture is then used to reattach the upper lateral cartilages to the spreader graft septal complex in a running horizontal mattress fashion. We can confirm the correct position and securement of our spreader grafts. We then continue with the remainder of our rhinoplasty.